So, for my older adult presentation, I decided to interview my great grandmother um, because she has definitely lived a long life. She was born in 1913, so that makes her 103. Um, and from all the stories that I've heard from my relatives over the years, I decided that she might have the most interesting life out of all of them. So, my great grandmother's name is Hetty, and she lived through the Great Depression, experienced adoption, was married twice, has a large family, had an interesting work life, and experienced different types of attachments over the years. So, when my grandmother was adopted, it was kind of an informal adoption arranged by the mom and midwife. So, in 1913, instead of going to a hospital to have a child, most times parents used midwives. So the midwife that worked with my grandma Hetty's bio mom ended up being the adoptive mom, and the adoptive mom also had 4 to 5 other children that she had arrangements with. So basically all of them came from different parents, and for whatever reason the parents and the midwife decided that the midwife would be best to take care of the children. So when my grandmother was 16 years old, she was experiencing the Great Depression along with the rest of the country. She was at an age where she could have worked, but because of the Great Depression, wasn't able to work, and she kind of suffered through all the extensiveness of the Great Depression and what it caused for America. My grandmother was then later married to a man named Sidney, who then had my Aunt Sis and my grandfather. When her husband died, she was remarried to a man named Bill, and she didn't have any children with Bill. So my family has probably 35 grandchildren in my generation, so we're technically the great-grandchildren, and then her grandchildren, which would be, my aunts and my uncles and my mom, that was about 15 people, and then she had 2 children. So my family's pretty large, and my grandma Hetty honestly is glued to it all. I can't imagine what life is like without her. And even though she's 103, I can understand that that's coming soon. But anyway, so when my grandmother was married to Sidney, her first husband, they owned a 200-and-quarter-acre pig farm, while he also ran a garbage hauling company. So she didn't do your typical work that you'd think. She was always the farmer's wife. She helped on the farm, shoveled poop, fed the pigs, worked with the hired hands, and had an interesting opportunity to work with inmates from the Greatersford prison. Back in that time, I guess there was some kind of deal worked out that if an inmate had only a few years left, they were able to, like my grandmother and grandfather were able to kind of buy the last of the inmate's time. So the inmate had to stay on the farm property and had to work for the rest of his time. And he could earn a little bit of money, but it wasn't really much. And then, I'm not sure at what age, but then my grandfather, Sidney, the first husband, passed away. So my grandmother remarried a man named Bill. Well, remarried to a man named Bill. He also ended up raising pigs, so that kind of worked out well. And for whatever strange reason, both of her husbands were really good at stock market, trading, so they were pretty well off because they did really well with their stock market. And my grandmother and her two husbands all only had an 8th grade education level because that was what was common at the time. So basically, my grandmother had an interesting life. She had a lot of things that impacted her life, and, what opportunities she had to look back on when she finally reached her stage 8 of integrity versus despair. My grandmother's pretty immobile at this point. She has a lot of body deterioration, but overall, like health-wise, she's pretty good. Mental health is still almost 100%. She remembers a lot of things. She doesn't have any concerning illnesses other than her body, I guess, is just tired and she's starting to deteriorate. So my first article is Sense of Coherence, Depressive Feelings, and Life Satisfaction in Older Persons, a closer look at the role of integrity and despair. I decided to use the citation, that way if anybody felt like they wanted to look at the article, they could, and I thought that would be the most useful way of trying to find the article. So this article really focused on a sense of coherence, depressive feelings, life satisfaction, and then quality of life. So the sense of coherence is basically some kind of test or questionnaire for people to take that are in the older adult stage. Excuse me. And it really, the article tried to, it was a study, it tried to really focus on how to improve quality of life because there was a rapid decline in the quality of life. So the elderly were given these questionnaires called the sense of coherence, and it was kind of to determine like their levels of depressive feelings and life satisfaction. And basically what it found was that the sense of coherence was actually pretty helpful in finding out the quality of life for people and how they felt about their lives. So in the article specifically, it did say that it was majority of life satisfaction, and in my opinion, the study wasn't equally represented as far as the people go. However, based on the sense of coherence, a majority of the people, had a good life and had some depressive feelings, but it wasn't a major impact on their life. So the article was pretty nice to read. As far as it goes with my grandmother, when she was telling me all of the stuff about her life, you could tell that she was very satisfied with her life. She was able to make a living and come from such a bad situation and a bad time, to being a wealthy married woman with a large family. Unfortunately, both of her husbands are not around any longer, so they haven't been able to see, where she's at and how her family has expanded over the years. And, like I said earlier in this video, my grandmother has a very good mental health, like she isn't having any issues, so she's very coherent. And even though she's 103, she really is positive and is enjoying life, even though she's not as active as she used to be. The second article was Measuring Effective Functioning in the Elderly, an application of Erikson's theory. So this really focused on elderly functioning. The study was based off of people in the Elder Hostel program, and this is basically a program where elderly men and women can participate in like these mini college courses where they, combine learning and traveling. So, elderly can keep active and they can keep using their minds. They're not just, sitting on the couch doing nothing. So, in my grandmother's sense, this one was very difficult for her because at this point she's not very active anymore. And she used to be very active, so she was participating on the farm, doing the farm work, and even when that ended, she was very active in family functions and doing all these things that she really enjoyed. But at this point in time, her being 103 and having bone deterioration, she's not able to be as active as she wanted to. So, quite frankly, this elder hostel program could have been very beneficial for my grandmother once she reached her late 80s and 90s, because she could have been active and still learning things that she wanted to learn and different things like that. In this third article, it talked about stages 1, 5, and 8 as the core life stages, because those are stages that you continuously cycle through every day. So, being that I spoke on the elderly and the older adult stage, this one is specifically the purpose and sense of belonging. Every day when things change, and you're experiencing life, you kind of get this understanding of what am I here for? What am I doing? What is going to make me feel good about my life? So in the study, they focused on the different levels of change between study 1 and study 2 about how people felt about their life. So for stage 8, they strongly spoke about, in the first study it decreased, so between study 1 and study 2 it decreased, but by study 3 and 4 it increased. So this is kind of the accepting life cycle and reflecting on life and being okay with your life. Like I said, my grandmother was very accepting of her life. She felt like she did really good as a wife, as a worker, and as a member of society. She was able to do a lot in her 103 years. And not many people live to that age, so she's pretty excited that she's reached that age. And she's very happy, with everything that's going on. And even though she has the bone deterioration, she's very happy and still understands her purpose in life and her sense of belonging, and everything in that category. So in the fourth article, it spoke about the article was Between Integrity and Despair Toward Construct Validation of Erikson's 8th Stage. So in this one, it talks about the integrated people, the non-exploring people, the pseudo-integrated people, and the despairing. So basically this is a range of people. Integrated were the most accepting of their life and their life satisfaction, and despairing were the people that were kind of depressed about their lives, felt like they didn't do much. So it was kind of great to see, the study was very diverse in who they were using. There were still a lot less in despairing people versus the integrated people, but there was some good diversity there. Basically, this measured the openness to experience, higher levels of perceived health, competence, and the geriatric depression scale. So people in the integrated category, were open to experiences, believed that their health was a lot better. They were very confident, and they had a lower level on the geriatric depression scale. And then the despairing had a higher depression rating, lower competence. They felt like their health was very poor, and they weren't open to experience. So the non-exploring and the pseudo-integrated were categories that fell in between that. So, they weren't more than, they had an average. They were sort of open to experiences, kind of perceived their health as okay, sort of competent, and kind of averaged out at the geriatric depression scale. So I know if my grandmother were to take the geriatric depression scale, she would, have a good score. She wouldn't be depressed at all. She feels like her health is good, even though she has deteriorating bones. At 103, she's like, I'm in perfect health. Because if you can make it to 103, then you do have really good health.